Okay.
We do not cultivate the fetal stem cells.
Right.
We just check up how they replicate in vitro, so then we can be sure that it will be replicating in the organism of our patient.
So it really is about only administering the right amount of cells for each patient, because once they're injected, that happens.
Yeah, very often the patient asks how many stem cells you will inject. Of course, when we are talking about the cultivated stem cells, it's important to know how many stem cells you will be injected, because they already proliferate in vitro and they don't have any potency to proliferate in the body. But when we are talking about the fetal stem cells, they can replicate. When other companies use cultivated stem cells, they cannot define their proliferative potential because they already use that potential in vitro. Yeah, and now if we are using the fetal stem cells, not cultivated stem cells, the whole their potential cover up the whole body of the patient, and we don't waste it in vitro cultivation. So that's why the amount of fetal stem cells may be not so high like the cultivated stem cells, but the proliferative potential of them is like 100 times higher when we are talking about like autological.
Very often you hear people say, why do you need new fetuses all the time? Why can't you just cultivate and replicate from one? But you're explaining that it's not nearly as powerful for a therapy, because they're not capable of going into the body and reproducing like the non-cultivated cells.
Yeah.
So what you're doing is basically the most powerful version of fetal stem cell therapy.
Yeah.
Yeah.
It's not only the most powerful of fetal stem cells therapy, it's the most powerful in whole world and in whole researches of the stem cells clinical use. Why? Because we have like 3 types of stem cells: embryonic stem cells, fetal stem cells, and also autologicals or allogenic, but cultivated cells. Embryonic is not safe. They can cause the cancer. Everybody knows about that.
Embryonic stem cells are derived from 4 to 5 day old blastocysts after in vitro fertilization. There are no organs or organ-specific stem cells formed at 4 to 5 days of gestation. Embryonic stem cells have a unique ability to develop into any type of cell in the body, which creates a problem: tumor formation. The ability of embryonic stem cells to form non-cancerous tumors, called teratomas, is one of their defining traits. It's also a frightening one, particularly for those who hope to develop therapies from the cells. Fetal stem cells are organ-specific stem cells derived from the tissues of a developing fetus, obtained between the 7th and 11th week of gestation. These cells have already undergone specialization in the germ layers and are tissue-specific.
Fetal stem cells are safe. They are not cultivated, so they don't lose its potential. And the autological or differentiated, for example, mesenchymal stem cells, they don't have any potential when they are injected. So maybe they can influence how in some way, but it cannot be so useful, and it can hold for the years, like we are talking about the fetal stem cells.
Now just walk towards me, just walk. No, just walk normal, just walk towards me.
This is 4-year-old Sophia Jones, around the time a pediatric neurologist diagnosed Sophia with Ulrich congenital muscular dystrophy.
And so when her doctor, he was a specialist in this particular disease, which is Ulrich muscular dystrophy, he did say that she's healthy now, but not for long. And she's 4 years old. She's as sweet as can be. That just was a complete shock. I mean, to know she's healthy now, not for long, like what does that mean?
The lifespan is probably 19, 20 years old. Yeah. You can plan on by the time she's 7 or 8 in a wheelchair. feeding tube because they don't have an appetite. At night, she'd have oxygen to help her breathe because the lungs, it affects the lungs.
And the other people that we've met in this situation, these people need assistance from when they start school. They have a full-time assistant next to them. And you think about that as they age, and Sophia's 13 years old now. And the dignity like that goes along with, you want your privacy as you get older, and you always have to have an aide with you, or mom or dad, or helping her to get out of the door, to go to the bathroom, to have an aide with her full time. I can't imagine waking up 5 times a night and having to turn my child because, they need to be repositioned and they cannot turn themselves, or too weak. Her doctor, when I would ask questions, he would actually say, "We'll cross that bridge when we get there." And you don't really know what you're dealing with. And quite frankly, you're not supposed to look on the internet, and that's exactly what we do. You go home, and it was very dark days ahead of us because it was shocking. But I think what's more shocking is that they have nothing to offer you. Mm-hmm. And so they gave us a diagnosis, they gave us a prognosis, and then they tell us to come back every 3 to 6 months to measure her decline, because there is no progression. There's just going to be regression from there. And that's really their solution. There is no drug. If there was a drug, at that point you're willing to do anything, right? I'd even take a drug. I'd take anything, but there was nothing concrete that we could do when we left the clinic.
So we were hoping for some type of treatment,
well,
things that we can do for her.
He did say, it was like, maybe in 10 years there's going to be something. So in 10 years, okay, but let's talk about the Jerry Lewis. He raised $2.45 billion, and that was like 50 years ago, and we still have nothing. When her doctor diagnosed her, he said lots of parents are desperate, and just so you know, not to bother trying anything, because he said he's seen parents go broke, literally, because you're so desperate and you're trying everything and nothing will work. And so that was his advice, like, do not put your money into anything else, because I'm telling you, it will not work.
So that was the picture. That was the picture that we were painted. This is what she was diagnosed at 4, and that's kind of the picture of that we were looking forward for the next, 16, 17 years.
Less than a year of Sophia's diagnosis, her parents discovered fetal stem cell therapy and decided to give it a try.
I wish you would tell me why. Do you want to build a snowman?
This is Sophia at muscular dystrophy camp at age 6, after receiving 2 annual fetal stem cell therapies in 2012 and 2013. The girl in the wheelchair to the right is 8 years old and has Sophia's exact same diagnosis, Ulrich congenital muscular dystrophy.
Everyone is actually in that situation except for us.
I first met Sophia the following year, after her 4th fetal stem cell therapy.
After the very first treatment, within that next week, she went from falling 15 to 20 times a day down to no times. She doesn't fall anymore.
Sophie, we're getting you a hula hoop, girl.
What? Are you ready?
Yep.
And I've been following Sophia's journey ever since.
Going back to the doctor who gave her the diagnosis, we sat down, I'll never forget, we sat down in the office and he said how everything's going as he's looking at his computer, and we said really good. And his neck about snapped off because he doesn't hear really good in his office. Mm-hmm. And he said, well, what's going on? You could tell that he was just super surprised to hear that she's doing well, and actually better than the year before. Because they want you to come back every year to just measure their decline.
Right.
And it was exciting to show them that she's gotten better.
That's great.
Yeah.
That's awesome.
No more falling down.
Congratulations. That's awesome.
No pain.
How do you personally feel? If you remember last year, and then after you got home, did you feel like you noticed any differences?
Well, later in the year, I noticed my grades, and I liked school more than I hated school, which was, I would never think that would ever happen, but.
Partly due to confusion from Sophia's American doctors over her improvements, in 2016, when Sophia was 8 years old, 4 years after her original diagnosis, a direct DNA sequencing analysis of Sophia's genes was conducted. evaluating the various mutations related to Ulrich congenital muscular dystrophy, which further cemented Sophia's diagnosis, showing heterozygous mutations of the COL6A2 gene, making it nearly impossible to argue that Sophia has been misdiagnosed. The Muscular Dystrophy Association also recommends this DNA test because genetic testing can shorten the time to diagnosis and prevent misdiagnosis of muscular dystrophies.
And so, yeah, the doctor, just our recent
within the last
visit,
6 months.
She was surprised and questioned the diagnosis.
Because she's never seen a child at her age look like her. By that point, they are in a wheelchair full time, and they're, using a feeding tube and a respirator, and she's just never needed anything like that.
And because of the scoliosis, a lot of times they have to put rods in their back at that point, at her age. She's straight.
It's worth noting that the peer-reviewed medical literature on Ulrich muscular dystrophy states most of the patients die of respiratory failure in the first decade of life.
So can we say that the situation pretty much like the same in comparison to the last time?
I would say stronger.
Stronger. Лучше,
I would say a lot more endurance with school and walking.
Good. Что лучше стала походка, да, выносливость. What about strength in extremities, like
With
in
strength?
hands?
Do you feel like you're stronger with your hands?
Kind of, probably the same.
Probably the same.
The same. And what about physical therapy? Are you doing
Physical
it like,
therapy?
Yes.
We're
like
doing a
on
lot
regular
of
basis.
physical
Yeah?
therapy.
Okay.
She is now taking initiative to do a lot of it on her own.
Okay.
So she's walking on the treadmill every single day, 1 mile at least, about a mile, and she can do 2 miles.
Хорошо, но они молодцы, я могу только
Great job.
похвалить.
Yeah. And
Ну,
you
вообще в целом.
experience sometimes any pain in your body? No, no painful feelings.
Хорошо, утруднений дыхания нет, все
What
хорошо.
about your breathing? Is it smooth and normal? Yeah, that's good.
Kids by 10, they're not walking with her condition. She's 13, and she keeps improving in strength. And so she's just very stable.
Hi. How are you? Good.
Nice seeing you, Maddie.
You too.
Yeah.
What are you guys gonna do?
Swim.
So nothing has gotten worse through all of these years. You're always worried about it. Even though we're doing all of this stuff for her, you're always in the back of your mind, like, is there something that's going to happen?
Yeah, sure, of
But
course.
her muscles and everything are showing that they're completely stable. So that's huge.
It's huge.
It's huge. I'm just so proud. I'm so proud of it. Everything's so good.
Yeah,
I'm
it's
so
awesome.
happy.
While following patients for this story, I frequently found family members also trying fetal stem cell therapy.
Through the years watching Sophia receive these treatments and having a benefit, I thought, I'm here. I'm going across the world with her, so I thought I'd give it a shot. There is a lot that goes into a major diagnosis like that, and the stress that comes along with it, and I think it triggers a lot of different things. And along with that came diagnosis of celiac, Hashimoto's, and Sjogren's. And so I was physically watching my body just completely, I was getting inflamed. I couldn't control, my weight was going up. I wasn't changing
Swollen.
anything. Yeah, I was just swelling every day. My eyes were poofed out, and I was just getting I was declining very quickly. And it was almost like spiraling out of control. Immediately, my inflammation started going away, and my numbers improved dramatically. So it was great to have some blood work to refer to, so I could see my blood work was improving. So my Hashimoto's is now fine. I don't take medication for my thyroid, and my celiac. That's
Which is huge, by the way.
That's negative. I no longer am celiac. Sjogren's, I think still there's something there, but I don't really deal with the effects of it, so I don't notice it. So I'm thrilled. I'm thankful that I can do it.
Yeah, she's come miles away from just her energy and really life being sucked back into her. So it's made a big difference.
In America, with all the autologous, so adult stem cells, they are like a big boom. People like to, I had that done, I had the stem cells.
Yes, there is some influence of injected of the autological stem cells, but it's not the same, and they cannot be sure that it will be divided. When we are talking about the adult stem cells, there is two types of procedures. One, when the person just took the stem cells, like from the fat, for example, is the most popular. There is two ways. They took from the fat and then they injected directly to the blood in an hour. In your body was stem cells. They took from your body stem cells and just injected the same stem cells into your body. How we can expect a big results from that? Of course not. And the second way, when they took the stem cells from your fat and then they cultivated them. But if they cultivated them, they have two options. The first one, they start proliferate, and all their potential was wasted in vitro, in the petri dish. And then they inject it to the patient. The first one reason why it's not so effective, and the second one is the same your stem cells. They have the same epigenetic memory. They have the same mistakes in their DNA. So it's very low opportunity them to work or to improve really rare or hard diseases.
Yeah, or neurological.
Or neurological, of course. And there is also always talking about that. Okay, we differentiated stem cells. We took your stem cells, and they will be differentiated into the neuronal stem cells. Of course, when you have the commercial mediums and you put there inside like thousands of microelements and growth factors, of course, they may transform to the neuronal stem cells in vitro. But in your body, there is not such growth factors in such amounts. So how can they transfer to the neuronal stem cells? They cannot.
So people getting adult stem cells for Parkinson's and things like that, they're not really going to be helped, because it cannot really help their nervous system.
Directly it cannot. How can mesenchymal stem cells took from your fat become neuronal cell from your head?
Right.
Why it does not transfer from your fat to your head in your body? If it can, so it will be improved by itself. It's almost impossible.
Yeah.
Also, you need to know about the main limitation. If you cultivate your adult stem cells from your body, you have only around 50 divisions. You will have the problem with it will be elderly cells, and they have no any proliferative potential when you inject it in the body.
Adult stem cells, also known as mesenchymal stem cells, are generally obtained from an adult's bone marrow or fat. However, they do not have the ability to transform into vital organ-specific stem cells like brain cells after human injection. Similarly, umbilical cord stem cells also lack the ability to transform into vital organ-specific stem cells such as brain cells after human injection. In contrast, fetal stem cells, which are already vital organ-specific stem cells, do not require transformation after injection to provide a wide array of genuine vital organ-specific stem cells, including neurological or brain stem cells, because they already are organ-specific stem cells at the time of injection.
What is your kind of response to people that get umbilical cord cells for similar ailments as what people go to MCell for?
With umbilical cord blood is the same situation like with autologicals or with the fat stem cells. Why? Again, they hope if they use it, it will be transformed in the neuronal stem cells. But there is no reason why they need to start to differentiate in that. The only benefit of the cord blood stem cells comparing to fat is that it's allogenic, not your cells. But it cannot help in the neurological diseases because there is no way how they can do that. There is no mechanism for that.
Which would mean that clinics and clinical trials around the world offering autologous stem cells derived from the patient's fat or bone marrow, or allogenic stem cells derived from an umbilical cord or another adult, are deficient in helping patients with neurological conditions, such as Parkinson's or multiple sclerosis. These companies do transparently state that they use only mesenchymal stem cells, which has been clearly documented in the mainstream medical literature to be unable to transform into vital organ cells after human injection. Mesenchymal stem cells can only transform into bone, cartilage, muscle, fat, and connective tissue after human injection.
To see?
So you can see another color and another structure, and also you can see the connections between the cells. So they already proliferated to the neuronal cells. So you can see connections between them. These connections is the connections which transfer the information.
They're starting to communicate with one another and build
network.
connections.
So this is what happens inside the body after injection.
Yep. You can see the example. This is the neurons and their connections.
We are literally seeing neuronal connections.
Yeah.
This is time-lapse footage of fetal neuronal cells in vitro, proliferating, creating new synapses, and communicating with one another, thus creating their own newly formed neuronal network. Fetal stem cells are the only stem cell type where true neuronal stem cells can be obtained, which is crucial for regenerating neuronal tissue for degenerative neuronal diseases.